Hi, hello, this is Dr. Steele. Today's questions asks if I can analyze and clarify what is the signs and symptoms of diabetes. As a reminder, I am not diagnosing or treating anybody in this video, only discussing medical topics like this. So signs and symptoms of diabetes. Well, the way I want you to see it is like this. I've been discussing in my previous streams and videos that diabetes is a metabolic disorder or imbalance that every time you and I eat, the food needs to be digested, be absorbed, and when it gets absorbed inside your vessels, because those are the highways where the food gets distributed, all those nutrients, unfortunately, the mechanism of picking up the food out of your vessels is not working as it used to work. And of course, we call it in medicine resistance of insulin, we call it metabolic imbalance, etc. But the main thing, my idea of this is just to remember that if food is taking longer to be taken out of the circulation per se, well, then those vessels are going to get damaged. And if they get damaged, they get for damage in this respect that the food starts sticking to those vessels per se, and then those vessels become occluded, and then no more blood goes through them, and then anything that gets blocked afterwards can have serious repercussions like a heart attack, a stroke, amputations, eye problems, kidney problems, nerve problems, etc. So our job is to do this, right? Our job is to find somebody like me to be able to control your diabetes, to explain how to prevent those complications, and to always be in the lookout for complications and detecting early before problems become irreversible. But let me explain. So now that you grasp that idea, I want you to remember that we have three main filters of your blood. The filters of your blood are your liver, for the most part, your kidneys, and as well as something called your spleen. Okay, so those organs or filters, they filter your blood in different ways, and they actually produce a lot of important stuff for us to be alive. So if any of those three organs, especially I'm going to focus on the kidney now, malfunctions, then we're not able to get rid of toxic substances. So what I'm saying is this: think about this. If your sugar is high and your sugar is not being picked up, remember that sugar acts like a diuretic. So those patients, because they have too much sugar, is not being picked up from the circulation in the kidney. Well, the kidney is going to see that as, oh, I need to get rid of that extra sugar because it's too much. So the patient is going to be complaining of what? That's one of the signs or symptoms per se of diabetes, which is urination, right? The patient is going to be peeing too much, especially at night. The main complaint is going to say, well, Dr. Steele, I'm just waking up too many times, 9 times every night to pee. I don't know what's going on. Now, let me remind you, a side note, that not all patients are going to feel symptoms, but most of the patients will. But there's some cases that the patients don't feel anything. Those are the patients that unfortunately have more end organ damage because they never felt anything. But going back to people that do feel the symptoms. So as I was explaining, so diuretic, sugar acts like a diuretic in the kidney. You start peeing more. You're complaining of going to the bathroom all the time. You're peeing too much. You're voiding too much, and you're complaining of, oh, I'm waking up at night, which is called nocturia, to pee too many times. More, I'm okay with twice a night, but these patients are going like 4, 9 times. So in addition to that, let's think about this. So that patient is peeing. So what are they going to feel too? They're going to feel very thirsty. Some of our patients, their complaint is, Dr. Steele, I was so thirsty when I was uncontrolled that actually I had to, put some ice in it to refresh myself because I was just so thirsty. But it didn't help because the sugars remained high. This patient was still peeing too much, so they felt thirsty all day. In addition, again, if the patient is not, the food is not being picked up and the sugar is high in the bloodstream, and I'm being repetitious on purpose so you can get it, is that they're going to feel hungry. They're going to feel famished all the time. But wait a minute, that's a vicious cycle. Well, how come, Dr. Steele? Because if you eat more, sugar goes up, you pee more, it's not being picked up. So the food, not all of it is being picked up. So the sugar is high in your vessels. So that extra food that you're eating that is still not going where it needs to go, it remains in your circulation and actually speeds up the problem of something called in medicine arteriosclerosis, meaning not hardening of the vessels, plaque forming on the vessels. That's what I was aiming at. So please understand that people that are uncontrolled, they're more likely to suffer from circulatory problems right away, which are, again, heart problems, like heart attacks, strokes, brain problems, brain attacks, strokes, amputations, eye problems, unfortunately, blindness, nerve problems, and of course, kidney problems and nerve problems. And nerves, remember I mentioned in the other video that the nerves do have their own vessels, and if the vessels are not getting enough oxygen because they're being blocked, unfortunately, patients don't feel their feet and they injure themselves. They don't even know that they injure themselves, and then they get infected, and that's how, unfortunately, people most of the time they lose a toe or a foot. So we want to prevent that from happening. So going back to signs and symptoms, so symptoms that are obscure that people don't think about. I mean, those symptoms that I explained, too much thirst, too much hunger, peeing all the time. Everybody knows that. But the other symptoms that you also need to be on the lookout is people that wake up very, very fatigued. They're like, I feel drained. I don't want to do anything. So those are the patients that also we need to look into. And of course, patients that have, with all due respect, sexual dysfunction, that's another tell sign that you can have diabetes. And of course, with all due respect, again, patients that have infections in their private parts, right? And remember that this happens because of this. There's a term in Latin that is called, in other words, the sugar is not only going up in your bloodstream, it's also going up in your tissues. Glucostachia, cutaneous glucostachia, that's the term. So what happens is that you and I, if you look under the microscope, we have bacteria, we have fungal organisms that live there. It's like we're not by ourselves, right? We have things that we eat things, and certain things are eating us in a way. So those bacterial organisms are there, but when the sugar is high, it's also high in your mucosa and your skin. So any area that has a lot of moisture, like in those areas that I just described, what that tends to, it's like miracle growth for them, the sugar. So you tend to have more of those infections. That's another tell sign that you can also have, diabetes or uncontrolled diabetes. Now, another thing that patients come to me, and I think you need to be aware of, is that patients that are very uncontrolled, because even though they eat, their body's not feeling that they have eaten, they get very moody. So there's another psychological component to this. It's like they start having mood disorders, like feeling very sad or feeling very upset all the time. So if your wife or husband or a family member their attitudes have changed in the last few months, it would be wise to have them go to see the doctor to check them out. Anyways, those are the signs and symptoms of diabetes. I hope you liked this video. Let me know if you have any other questions for the future. For now, remember that the greatest wealth is health, and make it a fantastic day today. Thank you for listening. And if you like this, smash that button. All right, thank you.